Since yesterday, we have confirmed 27 new cases of COVID-19. This means that 146 cases have now been identified in our province. We suspect up to 8 of these cases are community transmission, although we have information only on 7 and are waiting for confirmation of the 8th. 2 individuals are receiving care in ICU, which we have announced previously. I must also sadly report the first death from COVID-19 in our province. This individual was admitted in the ICU in the Edmonton zone on March 12th and passed away late yesterday. This patient was a male in his 60s with underlying medical conditions. This is extremely sad news, and all of us involved in Alberta's COVID response feel this very deeply. All of our thoughts are with this man's family and loved ones. AHS assures me that they are supporting them in this difficult time. As heartbreaking as this news is, it was expected. This is a dangerous virus. While most people who become ill with COVID only experience mild symptoms, it can make others very sick. We only have to look at other countries to see how serious it is. It has been reported that Italy has just surpassed China on COVID-19 deaths. I know that this news is frightening and will add to people's anxiety. We are doing all we can to fight the spread of this virus. This is why we have taken the extreme measures we have. We will get through this, but to do that, we need everyone's help. Take this seriously. Stay home unless it is essential for you to go out. Now is not the time for social gatherings. And practice social distancing if you do have to go out, including if you have to work outside the home. If you are struggling with today's news, reach out to friends and loved ones and talk. Tell them how you're feeling. Today's sad news is precisely why we are taking aggressive measures to reduce the spread of COVID-19. The restrictions we have put in place on mass gatherings, the closures of public recreation facilities, and the limitations on restaurant capacity, these are all efforts to protect the public's health and prevent spread. I urge you to take these measures seriously and do your best to limit your social interactions and practice social distancing.
Let me take a moment while I have the podium to express my sincere condolences to the family, the loved ones of the individual who has passed away from COVID-19. Our thoughts are with that family. I want to also emphasize our thoughts are with the care team that provided care to that individual over the last several days. You need to understand that this is very tough on our teams. They do everything they can. They work night and day trying to support individuals, hoping to see them recover and leave the hospital. These sorts of events are very, very tough on our healthcare workers, and our thoughts are with them as well at this time. I want to emphasize that we do provide support. We are supporting the family of the individual. We also provide support to our healthcare workers. We're all in this together. We need to support each other. Times will be tough in the next few weeks. We need to be there for each other, and we want to ensure that we are there to help support our healthcare workers.
I want to again extend my condolences to those who are grieving the loss of their loved one due to COVID-19 today. We have put aggressive measures in place to prevent the spread of this deadly infection and protect those who are most vulnerable to make the number of these tragic occurrences as small as possible. These measures are hard on all of us. I urge you to take them seriously. We must continue to stand strong together, even if from a distance. Thank you for coming, and I'm happy to take questions.